Hello, everyone. Welcome back to the English Speaking Show.
Hey there, so good to have you with us today.
I'm Ella.
And I'm Jake.
Jake, how are you feeling today?
I'm fine. But last time when I went to the doctor's office, I saw someone struggling to explain their symptoms in English.
Well, today we're going to help with exactly that.
Yes, we'll teach you how to speak at the doctor's office in English.
You'll learn how to make an appointment on the phone, how to describe your symptoms clearly.
And we'll explain common medical terms like prescription, stethoscope, blood pressure, so you understand what the doctor says.
This is super practical. People ask, what's wrong or where does it hurt all the time at clinics?
Exactly. And sometimes you feel terrible, but you don't know how to explain it in English.
So today, we'll give you the exact phrases you need. Simple, clear, and ready to use.
All right, let's start with the first step, calling to make an appointment.
This is usually the first time you speak English with the clinic, so it's important.
What's the best way to start the call?
Say, I'd like to make an appointment, please.
Very polite and clear.
Then they'll ask why you need to see the doctor.
How do we explain that?
You can say, I'm not feeling well. That's general.
But it's better to be specific, right?
Yes, you can say, I have a sore throat, I have a fever, I have a bad cough, or I have a headache.
What about stomach problems?
Say, I have stomach pain, or my stomach hurts.
Thoughtful. What if you're injured?
I hurt my ankle, or I twisted my wrist, or I have back pain.
So many options. What about asking for available times?
Simple. Say, what times are available? Or, do you have any openings this week?
What does openings mean?
Openings means available appointment time slots, free times in the schedule.
Let's see this in action. I'll be the patient. You be the receptionist.
Perfect. The phone is ringing. Good morning, City Medical Clinic. How can I help you?
Hi, I'd like to make an appointment, please.
Of course. What's the reason for your visit?
I've been having bad headaches and I feel dizzy sometimes.
I see. How long have you had these symptoms?
About 5 days now. It's getting worse.
All right. Let me check our schedule. When would you like to come in?
What times are available today or tomorrow? It's pretty urgent.
We have an opening tomorrow morning at 10:30 a.m. Does that work?
Yes, that works perfectly.
Great. Can I have your full name and date of birth?
Jake Miller, born March 15th, 1990.
And a phone number where we can reach you?
555-0123.
Perfect. You're scheduled for tomorrow at 10:30 a.m. Please arrive 10 minutes early to fill out paperwork.
Thank you so much.
You're welcome. Take care and see you tomorrow.
Let's break down what just happened.
Notice I was specific about my symptoms. I've been having bad headaches and I feel dizzy sometimes.
Not just I'm sick, specific symptoms help the receptionist understand urgency.
Exactly. And you added, it's getting worse. That shows it's urgent.
The receptionist asked, how long have you had these symptoms?
Very common question. Always answer with time. 5 days, since Monday, about 2 weeks.
What if you don't know exactly?
Say a few days or about a week. Approximate is fine.
And you said it's pretty urgent.
Yes, if you need to see the doctor quickly, say, it's urgent or can I come in today?
They also asked for date of birth and phone number.
Standard questions. Be ready with full name, date of birth, phone number, and maybe your address.
Now you're ready to make an appointment by phone.
Great. You made the appointment. Now you're at the clinic.
The doctor will ask about your symptoms. You need to describe them clearly.
What's the most important question?
Where does it hurt? Or what's wrong?
Let's learn how to answer. If your head hurts, say, I have a headache.
If your throat hurts, I have a sore throat.
If you're coughing a lot, I have a bad cough.
But sometimes the doctor needs more details.
Right. They might ask, when did it start?
Answer with time. It started 3 days ago, or it started on Monday, or it started yesterday.
What about, how bad is it?
Doctors often use a number scale. On a scale of 1 to 10, how bad is the pain?
1 means very little pain. 10 means the worst pain ever.
So you might say about 7 out of 10, or maybe 5 out of 10.
Another important question, does anything make it worse?
You can say, it hurts when I swallow, or it hurts when I breathe, or it hurts when I move my arm.
Or, it's worse in the morning, or it's worse at night.
These details help the doctor understand your problem better.
Now let's talk about medical terms you'll hear at the clinic.
What's the first one?
Stethoscope. That's the tool doctors use to listen to your heart and lungs.
The listening tool. It has 2 earpieces and goes on your chest.
Exactly. Next, blood pressure.
Blood pressure measures how your blood moves through your body. They put a cuff on your arm and pump it tight.
Normal blood pressure is important for health.
Next word, prescription.
A prescription is the doctor's written note for medicine. You take it to the pharmacy.
Not recipe. That's for cooking. Prescription is for medicine.
Very important difference.
And symptoms. Those are the signs that something is wrong.
Fever, cough, pain, these are all symptoms.
When the doctor asks, "What are your symptoms?" list everything that feels wrong.
Let's practice. I'll be the nurse. Jake is the patient.
Okay, I just arrived at the clinic.
Good morning. Please have a seat. Can I have your name and date of birth?
Jake Miller, March 15th, 1990.
Thank you. What brings you in today?
I've been having chest pain and trouble breathing.
I see. When did this start?
About 2 days ago, it's getting worse.
On a scale of 1 to 10, how bad is the pain?
Probably around 6 or 7 out of 10.
Does anything make it worse?
Yes, it hurts more when I take deep breaths.
All right, let me check your blood pressure first.
What's that?
Blood pressure measures how your blood flows through your body. They put this cuff on your arm, and it'll feel tight for a moment.
Okay, no problem.
All right, your blood pressure is 130/85. A little high, but okay.
Is that bad?
The doctor will discuss it with you. Now, let me check your temperature.
Sure.
Reading 99.5 degrees, slightly elevated. You have a low fever.
I thought so. I've been feeling hot.
The doctor will see you shortly. Please wait in exam room 3.
Thank you. Let's review what happened.
The nurse asked, "What brings you in today?"
That means, why are you here? Describe your main symptom.
You said, "I've been having chest pain and trouble breathing."
2 symptoms, very clear.
You pointed out using the pain scale, 6 or 7 out of 10.
Numbers help doctors understand how serious it is.
And you explained, "It hurts more when I take deep breaths."
That detail is important. It helps the doctor diagnose the problem.
The nurse used the blood pressure cuff and checked temperature.
Standard procedures. Don't be nervous. These are normal checks.
Now you know what to expect when the nurse checks you.
Okay. Now let's look at common mistakes learners make at the doctor's office.
Yes, we'll show the mistake and the correct way.
Mistake number 1. Many learners say, "My stomach is painful."
But we say, "My stomach hurts," or "I have stomach pain."
We don't say is painful, we say hurts.
My head hurts, my leg hurts, my back hurts.
Exactly.
Mistake number 2, learners say, "I am coughing since Monday."
The right way, I've been coughing since Monday.
Use have been plus ing for ongoing symptoms.
I've been feeling dizzy since yesterday, or I've been having headaches since last week.
Present perfect continuous. Perfect for symptoms over time.
Mistake number 3. People say, the doctor gave me a recipe.
No, that's for cooking.
Say, the doctor gave me a prescription.
Prescription. Prescription. For medicine.
Recipe is for food, prescription is for medicine.
Mistake number 4. Learners say, I have temperature.
We say, I have a fever.
Everyone has a temperature, but if it's too high, you have a fever.
Normal temperature is about 98.6 degrees Fahrenheit or 37 degrees Celsius.
Above that, say, I have a fever.
Mistake number 5. People say, my head is paining.
Say, my head hurts, or I have a headache.
We don't use is paining in English.
My throat hurts, I have a sore throat. My ankle hurts, I have ankle pain.
Use hurts or I have body part pain, not is paining.
Avoid these 5 mistakes and you'll sound much more natural at the doctor's office.
These are super common, so don't worry if you've made them before.
Now you know the correct way.
Now let's see a complete doctor visit from start to finish.
Yes, I'll be the doctor. Jake is the patient.
I'm in the exam room waiting.
Hello, I'm Dr. Anderson. How are you feeling today?
Hi, doctor. Not great, honestly.
I see. Tell me what's going on.
I've been having really bad chest pain for about 3 days now, and I'm having trouble breathing sometimes.
Chest pain and breathing problems. That's important. On a scale of 1 to 10, how bad is the pain?
Right now, maybe 6 out of 10, but yesterday it was 8 out of 10.
Does anything make it worse?
Yes, when I take deep breaths, the pain gets much worse, and when I lie down flat.
I see. Any other symptoms? Fever? Dizziness?
I've had a low fever, around 99 or 100 degrees, and yes, a little dizzy when I stand up quickly.
How long have you been feeling dizzy?
Maybe 2 days.
All right, let me examine you. I'm going to use my stethoscope now.
What's a stethoscope?
It's this listening tool. I put it on your chest to hear your heart and lungs. It might feel cold.
Okay.
All right, take a deep breath in and out. Again, in and out.
Ow, that hurts when I breathe deeply.
I hear some crackling in your left lung. That could be fluid or inflammation.
Is that serious?
It needs treatment, but you'll be fine. I think you have pneumonia. That's a lung infection.
Pneumonia? What does that mean?
It means your lung is infected. Bacteria or a virus got in there and caused inflammation.
Will I need to go to the hospital?
Not necessarily. We can treat this with antibiotics, medicine that kills the infection.
That's good.
I'm going to write you a prescription. It's called amoxicillin. Take it 3 times a day for 10 days.
3 times a day for 10 days. Got it.
Very important. Take all the pills, even if you start feeling better after 3 or 4 days.
Okay, I'll finish all of them.
You should also rest, drink lots of water, and avoid heavy exercise for at least a week.
When will I start feeling better?
You should feel improvement in 2 to 3 days. But if you get worse, if the pain increases or you have trouble breathing, go to the emergency room immediately.
Concerned. Should I come back for a follow-up?
Yes, make an appointment for 2 weeks from now. We'll check if the infection is completely gone.
Thank you, doctor.
You're welcome. Take this prescription to any pharmacy. Feel better soon.
Thank you.
Let's quickly review the important phrases.
I described my symptoms clearly. I've been having chest pain for 3 days.
And you use the pain scale, 6 out of 10.
I explained what makes it worse. It hurts when I take deep breaths.
I explained the stethoscope. It's a listening tool for your heart and lungs.
I said, okay.
And I asked, does anything make it worse, and any other symptoms?
Very common doctor questions. Be ready to answer them.
And always ask questions if you don't understand something.
Now it's your turn. Let's build your symptom sentences.
First pattern, I have blank.
I have a headache.
I have back pain.
Your turn, viewers. Think of your symptom. I have blank.
Second pattern, it started blank.
It started 3 days ago.
It started yesterday morning.
Now you. It started blank.
Last pattern, it hurts when I blank.
It hurts when I swallow.
It hurts when I walk.
Friends, your turn. It hurts when I blank.
Excellent! You now have 3 sentences to describe your symptoms.
Use these next time you visit a doctor. So today, you learned how to speak at the doctor's office in English.
We covered how to make an appointment by phone, phrases like I'd like to make an appointment, and what times are available.
How to describe your symptoms clearly. I have a fever. It started 3 days ago. It hurts when I breathe.
We explained medical terms like stethoscope, blood pressure, prescription, and symptoms.
We showed you common mistakes to avoid, like saying recipe instead of prescription.
And you practiced a complete doctor's visit from start to finish.
Remember, you don't need perfect English, just clear, simple phrases.
Now it's your turn. Next time you need a doctor, use these phrases.
Start with something simple. Call and say, I'd like to make an appointment. I'm not feeling well.
And subscribe to the English Speaking Show for more practical English lessons like this.
We post new episodes every week to help you speak English naturally in real situations.
Thank you so much for learning with us today.
You're now ready to communicate confidently at any doctor's office.
See you next time. Goodbye.
See you next time. Goodbye.